I hope I can change the slide. Yes, it works. This survey actually concerned 3 most frequently used PET-CT examinations. So 2 tests with the use of fluorine 18 and 1 with GAL 68. These are 2 most frequently used PET-CT examinations. So what data, what did we expect in the survey? We expected the data that would allow us to examine later the data, the dose information was taken from the basic PET-CT scanner data and nuclear medicine data. When we use the hybrids, we usually get the information mainly from nuclear medicine data. However, the PET-CT scanner data needs to be obtained separately. And in this survey questionnaire, we managed to get both types of data. So what activity was performed and what data indices of tomographic examination was obtained. So as I said, we have sent a number of supporting letters and it was not only the National Center for Radiation Protection in Healthcare, but also Dr. Kołodziejczyk, the president of the Polish Association of Atomic Energy, and Professor Królicki, who is the national consultant in nuclear medicine. We have all sent the supporting letters to invite everyone to participate in the survey. What outcome have we received? Actually, there is a number of data, and the combination of analysis that can be performed on the basis of the data obtained is really huge. Well, first of all, we have sent the survey questionnaires to 35 nuclear medicine departments that were on our national list. Nearly half of the departments positively replied to our request, and they provided us with the data. Actually, 1 department sent data for 2 scanners, not only for 1 scanner. And the declared total annual number of examinations, I mean PET-CT examinations for these 2 radiopharmaceuticals that I mentioned before, is more than 30,000 in 2021. Before I will show you some curves that present the basic feedback, the basic data that we received from the survey questionnaire, I would like to stress one thing. In the first analysis that we performed, we tried to find out whether the values presented to us are coherent, whether they are coherent with the values that we would expect to get. So here we can see 2 SA value. This is the SA value is from the CRP publication. So this is a very interesting parameter that indicates that includes the height and the weight. This is not an analytical equation, as you can see, but it seems to be in line with such a parameter as weight. So the surface of the body and the weight seems to be correlated in patients. So as you may realize, we cannot speak about a standard human being or a standard patient as regards the parameters as BMI index, weight or height. these are the people that slightly different standard compared to an average person. And another value that you can see here is SSDE. This is a parameter that, similar to DLP in nature, these two parameters correspond to the value of the doses. There are some coefficients that allow us to get the proper value of the dose. So specific size dose estimate is a special parameter with some modifier. It includes an empirical modifier that relates to volume tomographic index. The pointer works. So here you can see the empirical value, AP and LAT. These are the diameters of the patients in the direction of AP and LAT. So alongside and across. And this is the parameter that refers to, I'm trying to move the pointer, oh, it doesn't work. So this is a parameter that is correlated with the value of the patient. So BMI index is widely known, so we know that the weight is expressed in kilograms and the height is expressed in meters. And we need to remember about that because in case of other values we have centimeters, not meters applied. I think that you are all familiar with these values. And here you can see a list of ICD-10 codes. This is the International Classification of Diseases codes in version 10 of the classification. And here you can see the list of around 20 codes, and this is the list of the type of exams that were performed. Actually there were minimum 10 patients for each of the disease codes that we have received. Of course, in total, the number of different diseases were examined, but these are the most common ones that were examined with the use of PET-CT. And now let me speak briefly about C7A. This is malignant neuroendocrine tumors. So here in the ICD-10 code, you can see that all nuclear medicine departments that participated in the survey questionnaire used the codes that you can see here. I will try to show you. So these triangles indicate nuclear medicine departments, so you can see whether you are on the list or not, and whether the data presented here. Well, I would like to stress that this is very initial data that I am presenting now, and I would like you to verify the data that I am presenting. We will be in touch. So as you can see, the nuclear medicine departments are presented in different colors. Every nuclear department has a different color assigned. So in different curves and different diagrams, we can see different colors. Women are triangles and men are circles. The three radiopharmaceuticals are also indicated in the triangles and in the circles. Plus means it's FDG, cross it's gallium, and an asterisk is choline. As regards nuclear medicine, here on the vertical axis you have the activity, on the horizontal axis you can see the surface of the weight or the surface of the body, and here you can observe, you can see that there is a close relationship between and correlation between the weight and the body surface as regards the activity.
It's a part on CT. So DLP will be also the vertical axis. Then you've got weight in kilograms. So the relations can be very different. Colors are of importance because they mean the nuclear medicine department. So these first graphs show you that the CT systems work differently, operate differently. And this is a parameter that allows us to compare indexes of doses such as DLP and specific size dose estimates, SSDE. So these indices, they should be mainly placed on the straight line. But it's not always the case because there are some specific tomographic protocols that can have problems with linearity. It should be a straight line, but it's not everywhere possible. Then next, ICD-10. This is malignant tumor of colon. If you take a look at the colors, different colors, usually departments follow the basic rule, that is activity per weight, but sometimes it varies. Some departments use the formula, they achieve specific value, but if you go to another department, it looks like a lot of points, dots, but it usually is along the line. This is a surface, this is tomographic part, and interdependence. This is a much better linear interdependence. It's CT. So you can see that the filling of the squares or circles with plus means that contrast was administered orally, and X means that it has been administered intravenously. C25, malignant neoplasm of pancreas, tomographic part. Again, you can see this interdependence. It's not that strong for DLP and SSDE. It should be clarified why this situation is like that. C34, malignant neoplasm of bronchus and lung. So again, if we look at various departments, there are some interdependencies. They are usually quite clear, but there are significant differences among nuclear medicine facilities. Tomographic part, again, DLP, SSDE, quite a good linear interdependence. C40C is malignant melanoma of skin. So specific departments follow their own protocols. but they are different protocols depending on the department. Computed tomography. In some departments, there are no interdependencies between those parameters and the size of the patient. Interdependence between the key dose parameters is linear. C50, a malignant neoplasma of breast, so it concerns women only. FDG with fluor, not only fluor. Here, for example, you can see an exam with gallium-68. This is a part for tomography, so contrast has been administered. Some departments administer contrast. Interdependence between those parameters, C54. It's the malignant neoplasm of corpus uteri, so it's usually for women. It's hard to observe some interdependence between those parameters. C56, malignant neoplasm of ovary, a part of nuclear medicine. And this is the CT part, and interdependence between those parameters. C61, malignant neoplasm of prostate. So this is for males only. So these are the exams with the use of choline. Quite a lot of exams, so you can see this dependence between activity and size of the body. So this relation is quite strong. Tomographic part. It varies, it depends, so there is good interdependence concerning the size of the patients. It's one of the best interdependency between the doses. C64, it's the malignant neoplasm of kidneys, except renal pelvis. It differs depending on the department, so we can say that there is this relation between activity and the size of patient. It's not significant, statistically significant. The same goes for interdependence with the patient's size. It can be due to the protocol of this exam. Interdependence between those parameters is quite strong. C75, malignant neoplasm of other endocrine glands and related structures. As you can see, there are some exceptions here that will have to be clarified. This shows a good situation when it comes to the activity administered and the weight of the patients. This is the part for CT. And here, there is quite a strange interdependence between those parameters, and we will clarify this. C76, malignant neoplasm of other and ill-defined sites. Very few results, but these interdependencies, if you look at the colors, they vary when we look at the interdependence with the weight. CT part, interdependence between those parameters. C81, it's Hodgkin lymphoma. It varies depending on the department. Some departments follow a standard procedure, activity per the patient's body weight, but this rule is not followed by all the departments. CT part, you can see, the first observation is that many departments use different procedures. So it's not always that some departments proceed differently. So it's hard to identify regularity with the values. So Hodgkin lymphoma, some departments administer contrast. Interdependencies between those parameters. 82, it's follicular lymphoma. This is a traditional layout. This is CT part. Sometimes there are such interdependencies. So this relation to the dose and the patient size. 83, diffuse non-Hodgkin's lymphoma. So these interdependencies for different departments are quite strong. So departments work differently. The CT part, again, these dependencies on the patient's size do occur. Dependencies between the key dose parameters is quite strong. So these results are consistent. Coming to the end of the presentation, C85, other specified and unspecified types of non-Hodgkin lymphoma. So similar situation here. This is for the CT part and again some dependencies. D38, neoplasm of uncertain behavior of middle ear and respiratory and intrathoracic organs. So this configuration, this layout is quite good. So here you can see the activity that has been administered to the patient. This is the CT part. So this situation is not that great. There are, again, it depends on the specific departments. Each of the departments uses a specific system to place the values, especially when we think of the dose parameters. Here, there are quite a lot of exams that use contrast. 48, this is neoplasm of uncertain or unknown behavior of other and unspecified sites, so we don't know what we're dealing with. So here you can see there's dependence between activity and the body weight. CT part and interdependence between those parameters, and E34, endocrine disorders. One of the departments shows a strong correlation between the patient's weight and activity. Other departments have a smaller correlation. So if we consider the surface, since in the surface we not only address the weight but also the height and the patient's diameter is important. And so PA has been provided. Take a look at the second graph. So it only presents this part that actually includes such parameters. So it's the same department. So these are data for the same department. The other departments are not included because there is no data available. This empirical formula to calculate the body surface is in line with the procedure that includes includes interdependency between the weight and activity. And this is CT part. So these interdependencies, when it comes to the weight, well, BMI and weight interdependence is quite strong. And data parameters interdependence. The next steps, luckily, under this project, we have endorsed and we actually have agreed with our expert, John Dixon, who will help us to work on the data. We will also request all nuclear medicine departments to verify the data they have provided. Of course, we will provide you access to this presentation. We will send it to all nuclear medicine departments. We will ask you to verify whether all the data you have provided, whether they have been recorded correctly, and whether we have interpreted the data correctly. To make sure that we will be able to work on this data. And any cooperation with you is more than welcome. We hope that at least some of you would like to get involved to draft a publication. And this email address will not disappear. You will be still able to use it, POL9027 @ So you can use it all the time. And thank you for allowing me to present this brief report